All right, I'm back. Now we're going to be talking about a visual sensory deprivation or deficiency, visual impairment disorders. Taking a look at these pictures, can you tell me what causes each of these pictures or how someone is viewing these pictures? Well, A is caused by glaucoma, B is caused by cataracts, and C is caused by macular degeneration. Cataracts, which was the first picture you saw on the last slide, and it is the cataract vision that you see in the upper corner here, is when your lens loses transparency. Your eyes become cloudy. A lot of times you can see this visually on a client if they are suffering from cataracts. Other signs and symptoms might be a sensitivity to light and glare, halos around lights, fading or yellowing colors, or double vision or multiple vision in one eye. Sometimes people only need cataract surgery for one eye. Sometimes they need it for both. Sometimes they need it for both and they get it for one eye. One of the new things they're doing now, and my dad got this done, he's 86 years old. He had cataracts removed, but at the same time he had LASIK done. When they did this, he now does not have to wear glasses all the time, which is amazing for an 86-year-old. Cataracts usually is usually bilateral. Unilateral is usually from trauma. So remember that. That's pretty important. Cataracts are usually bilateral, but they can be unilateral from trauma. Risk factors, aging is a big one. We see this in our elderly community a lot. Congenital, long-term UVB exposure. Where would you get long-term UVB exposure? A lot of time welders have long-term UVB exposure. Severe eye injury can also is a risk factor, but that's usually the unilateral one. Some drugs can cause cataracts, corticosteroids or chlorpromazine. We also see early onset of cataracts in diabetics with diabetes mellitus, tobacco smoking, heavy alcohol consumption. All of these can affect your vision. The treatment is usually the surgical removal of a lens with a lens implant when significant vision loss has occurred. Lens implants are now corrective. It's almost like a LASIK procedure, and that can really help with if you have to wear glasses. Glaucoma, you'll kind of see the normal view and a glaucoma view, is usually high pressure, usually due to high fluid pressure in the eye. Early signs and symptoms are sensitivity to light and glare, poor night vision and halos around lights, painless gradual loss of peripheral vision. One of the funniest things I can remember happening, my mom has glaucoma. It is genetic. My grandfathers, both sides, had glaucoma. I have actually been tested and very, very strongly tested for glaucoma because of the family. But my mom is very on top of all this. She's a diabetic. She has glaucoma, so she gets her eyes checked constantly. We were all playing baseball one night for a team or softball we play team on, and she left the game. It was like 6 o'clock at night. It was brighter when she was there, so she had her sunglasses on. So she's driving home, and she felt like, oh my gosh, she's losing vision, and her night vision became very poor. She thought it was so bad, she pulled over to the side of the highway fearing that she was having a stroke, when what it was is she forgot to take off her sunglasses. But it is a lot like that view. If you think about driving at night with your sunglasses on, that's kind of what your night vision's like with glaucoma. Risk factors, age is usually a risk factor. Usually it's greater than 60 years old, but it can be congenital. It's secondary to infection sometimes, cataracts, tumor, hemorrhage, or eye trauma. And the world leading cause of blindness is glaucoma. It's the leading cause among African Americans, and that kind of goes hand in hand with African Americans having a high incidence of diabetes as well. 25% goes undetected, which amazes me since I get tested every time I go to the eye doctor, but I don't think people go to the eye doctor as frequently as I do. Primary forms are open-angle glaucoma and closed-angle glaucoma. The treatments are usually medications, which enhance pupillary constriction, and iridectomy, which creates an opening in the iris and facilitates drainage of that high fluid pressure in your aqueous humor. One thing you have to be very, very careful with, and you will see this when you are passing meds in your long-term care clinical sites, is that some types of medication can cause increased pressure in the eyes. So you need to make sure that your patients don't have glaucoma who are taking these medications. So when you're reading side effects of medications and writing out all those millions of med cards that you poor people have, make sure that you check to make sure your client doesn't have glaucoma if their medication can cause high pressure in the eyes. So nursing diagnosis and interventions due to disturbed sensory perception, you always want to address them by name and identify yourself with each interaction. Orient to time, place, person, situation as needed. Okay, speak in normal tones. Just because they can't see you or have a hard time seeing you doesn't mean they can't hear you. In fact, it's just the opposite. People who have visual disturbances sometimes can make it up in their other senses by having a higher, a stronger hearing perception versus because they've lost their visual perception. Acknowledge your presence. So don't sneak up on somebody with a vision problem. As funny as that may seem to you, it sure is not funny to that person. Provide visual aids and tools to compensate. Diversion through other senses. Like I said, usually when they lack in one sense, they can be stronger in another. Also, some of the tools you can use to compensate for visual issues is bright, non-glaring lights when they're reading, especially large print books. You've seen those at the library or at bookstores. My mom uses those, and she is an avid reader. She really cannot read the books anymore that have the smaller print. In fact, I just gave her one the other day. She's like, I can't read this. It's way too small. Books on tape are nice, especially for someone with a visual disturbance that is having a hard time reading but loves books. Books on tape are great. I like to listen to books on tape in the car, but hopefully somebody that has a visual disturbance isn't driving in their car listening to a book on tape, because that can be sensory overload for some people. I know I have driven through a few red lights because I have a book on tape going. I'm so into the storyline that I forget I'm driving. Okay, don't pass that around. Phone with large buttons, like the jitterbug. You see that in our elderly community, and that is a huge stereotype. I should have stereotyped with the jitterbug, but you see in the commercials, everybody that's using that jitterbug is usually an older person. But that's that phone with the real large buttons on it. Clocks that can be felt as well. Okay, I have a clock by my bed. I have horrible eyesight without my glasses or contacts. And so because I don't sleep in my contacts, of course, and I don't sleep in my glasses sometimes I fall asleep with them on, I have a clock with very, very large digital numbers that I can see. So it's very helpful. Orient to your environment. Imagine you cannot see, you're in the hospital, you wake up and it's dark out. Okay, you're not in your usual environment. So you need to be oriented to that environment. Call light, make sure it's close to that person so that they can call you. Personal items. If they do wear glasses, make sure they're not across the room so that when they wake up, they can put on their glasses so they can see. Don't move furniture around. If they're unable to see, they need to know where their furniture is at all times. Orient them to their room and leave the furniture the way it is. If people come to visit them, make sure you put the furniture back to where it was. And make sure you orient them to their bathroom. Assisting with meals, we kind of talked about this in a previous slide. You can let them know where their food is with where their utensils are by using the face of a clock. Your utensils are at 3 o'clock and 9 o'clock beside your plate. Remove lids, butter, breads, cut foods. I can still remember my uncle who has very, very poor vision. Boy, you must think none of my family can see. My husband has an eye like an eagle, but my immediate family do have trouble seeing. My uncle is pretty much blind. So when he came to visit, we had all this food out, which we always do, and he thought the egg salad was popcorn, and he dipped his hand in it to get the popcorn and got a handful of egg salad, which made us all laugh, even him. So you need to orient them to food and where things are. Assist with mobility and ambulation. You want to walk slightly ahead of a person who has visual issues. Makes sense if you think they're not going to be the leader if they're not sure where they're walking, especially in a new environment like a hospital or a long-term care facility. Nursing diagnosis and interventions for visual impairment, they are definitely at risk for injury and falls. Mostly I'm thinking of that kind of person coming into the hospital for surgery or procedure or something like that, where they're not used to their environment. They're definitely at risk for injury and falls because they don't know where everything is, even when you orient them. Everything's new. They can also go through sensory overload. So now you've got their visual disturbance, they're in sensory overload, and they're supposed to get up and walk. They could get very confused. So make sure you raise the 2 side rails up, and that will help remind them to ask for help, and make sure their call light is close by them. Anxiety, okay, especially in a new place, new environment, if they cannot see, their anxiety, I'm sure, is very high. So encourage them to verbalize any fears or anger or feelings of that they're having in this new environment. Discuss the effect of impaired vision on lifestyle. So if they're just starting with this new sensory deficit of vision sensory deficit, educate them on different things, how they can talk to somebody about where, have their partner involved, or their husband or their wife, and let them know that they can describe a plate to them with using the face of a clock. Make sure that they tell them not to change the furniture around, different things they need to do. Different things you need to do is always introduce yourself when entering the room, which we talked about. Explain our procedures clearly. Make sure when you do touch them, you're letting them know, okay, I'm going to be touching you now, so you don't scare them. And identify coping strategies that they can go through. All this can be found in your Ackley book. Make sure you're using that. I'm sure you guys are that's becoming your Bible as you're doing your care plans and your medication cards. Sensory disorders equals safety concerns. Assess impact on clients' functioning. So taste buds can be your taste can be taken away with different things. Medications can reduce your taste buds. Also, if you lose your sense of smell, sometimes you cannot taste food like you could. So make sure if this is altered to consider neurodisorder or a trauma could have possibly occurred, or it could be as simple as that they've got a sinus infection. They can't smell their food, so they're not tasting it. Smell disorders often go unnoticed. Receptors are located in the roof of the nasal cavity, so any trauma or injury to the face or the nasal cavity can decrease their smell. My brother-in-law had surgery on his sinuses. He no longer can smell, so his taste is completely gone. So he's kind of upset about that. Things that used to taste good, he doesn't really taste them anymore. And touch. Receptors located are throughout the skin. We talk a lot about issues with touch. When are they not having unable to touch, or they don't feel cold or heat? Think about that. Okay, what kind of clients have that issue? We're thinking our diabetic patients have that issue. Chronic hypertension patients have that issue. This is a huge risk for injury and skin breakdown. They don't know that they have a pressure ulcer, so they continue to sit in their wheelchair because they can't feel it, or they don't know they have those ulcers on their legs. Cognition, the intellectual ability to think and the process of knowing and interacting with the world. Through awareness, attention, sensation, and perception, which we talked about, cognition, judgment, memory, and learning, a person fully experiences and interacts with the environment. So there are different ways to assess cognition and mentation. I'm going to stop this video here. I'm going to put this video through. If you're wondering why I keep stopping and starting, it's because I get 15 minutes free of each video on the process I'm using. So that's why I usually only go up to about 15 minutes and then restart over. But this is a good place to stop, so I will talk to you later.